morning. You're listening to Complete Health with Dr. Mike Rogers. I'm Adam Owens, and Dr. Rogers joins me from Complete Health Dentistry in the studio this morning. Good morning, Dr. Rogers.
Good morning, Adam. How are you today?
Very good, thanks. We're here today to talk about growth issues, airway issues, teeth alignment issues, and more. And it all kind of falls into one circle of potential problems. Can you talk just a little bit about what some people might experience, especially as their children are growing and developing around alignment and airway issues?
That's a great question, Adam. What it is airway problems start, it can be almost at the time of birth. And so it goes back all the way that if the child becomes congested and starts to posture differently or breathe differently, more through a mouth than through their nose, it can actually start at that point. And so moving forward, it can create a whole host of developmental issues.
So airway issues, we're really talking about the way that you naturally breathe in and out. And so many of us just take for granted how easy and natural that comes. But you're saying that there are some things that can happen to negatively impact that process.
Yes, there is. Once a child starts breathing through their mouth, because mouth is not normal breathing. Normal breathing comes through the nose. Mouth breathing, if you think about it, is rescue breathing. It's emergency breathing. We do mouth breathing on someone doing CPR in an emergency.
Right, or when you're running really hard or your body is working at full tilt.
Correct. And even then, studies show that if you breathe through your nose, over a period of time, if you train yourself that way, you can improve performance through nose breathing, because it breathing through your nose humidifies the air, sterilizes the air, conditions the air so that our body can take it in better. When we breathe through our mouth, we're not filtering the air, so we're breathing in all those impurities, which now limits how our body functions.
So we've got these great natural filters built in, but if our body grows in a way that changes our mechanism for breathing, we all of a sudden don't make use of the filter. So what can cause airway issues?
Well, airway issues could be it starts out as, say, a cold, a breathing problem even as an infant. They get a cold, they get an allergy of some sort.
Some kind of congestion.
Correct. And that chronic issue can turn into this airway problem. And what it does is it creates this chronic effect of someone breathing through their mouth. It's now conditioned into this child that they breathe through their mouth. It's easy. It turns out to be easier at that point for them to breathe through their mouth than to breathe through their nose.
And what about how does teeth alignment factor into this, or crooked teeth?
Well, actually, they're two great question. The teeth alignment will actually form because if we're breathing through our mouth, our jaw posture is lower. Oh. And so as our jaw posture is lower, our face, the muscles of our face actually don't grow and develop and get stronger to pull our face outward. So as that grows smaller and smaller, the roof of our mouth, which is the floor of our nose, actually grows up. It can create a deviated septum. It can create a collapse of all the turbinates and all the bone structure inside our sinuses and our nasal passages. So now that creates an issue there. And as that constricts more and more, it becomes harder to breathe through your nose, more difficult to breathe through your nose. We do radiographic studies on our patients, and we see that some of these children are breathing through airway that's the size of a swizzle stick.
Whoa.
And so if you think of that, if they're trying to breathe and get that much air in, it's creating a growth and development issue long term. So you start early with having a problem breathing, and that just manifests itself into different things. And there's many symptoms that can show up.
So it almost sounds like, and correct me if I'm wrong here, but it almost sounds like if there is a breathing issue early on in life, it can actually trigger a kind of cascade of different effects which will worsen that breathing issue. So if the mouth, you're breathing through your mouth, suddenly your teeth kind of grow in a different shape, your palate changes shape a little bit, and that actually exacerbates the issue of the airway problem.
It really does. It really does.
Now, so does that mean that crooked teeth are it's not a genetic issue, but it's actually an issue that is caused by something else happening to you?
In most times, yes.
Huh.
And the reason for that is, if you look at history, prehistoric skulls, and you go back and go, okay, here's skulls from all these people in prehistoric times, all their arches were these beautifully arched, round-shaped Roman architecture.
Sort of
form.
ideal.
Exactly.
Huh.
You move forward, even in the
Middle Ages?
Middle Ages.
Yeah,
That's
yeah,
the
yeah,
word.
yeah.
I lost it there.
It's early,
In,
you're allowed.
in the Middle Ages, if you looked at the skulls of the aristocrats, the people who were wealthy and living on a more softer diet, sweets and sugars and things like that, ground foods, compared to the peasants who had to really sustain their lives with subsistence and hard foods, their skulls, you can see a difference in. The aristocrats, the high-end people, had more narrowing of the faces, more, if you look at paintings and all of that of these aristocrats versus the peasants. Peasants had these big, broad, round faces. The aristocrats had these narrow hatchet faces.
Wow.
And so, once again, it's growth and development. It's what we do and how we do, and we're going to get into a little bit more detail on that. But it's also what we do once we start developing and how we grow into things like that to make our muscles stronger.
So, I was going to ask you, do crooked teeth cause airway problems? It almost sounds like airway problems cause crooked teeth to some degree.
They do.
Yeah.
The airway problems are is the root cause that create the crooked teeth. But as the teeth get more crooked, it can cycle back and create more of an airway issue.
So we've got about a minute left in this segment, but I want to ask you, at what age can airway problems begin to manifest themselves?
Right at birth.
Really?
Right at birth, that early. If there's some type of obstruction, chronic obstruction of the airway in a newborn, it can start to predispose that child to mouth breathing. And once that mouth breathing begins, as I was saying earlier, it can just sort of send them on the path to this
cycle.
way.
Yeah. Wow. Okay. Well, you're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry of Northeast Pennsylvania. We're talking about airway issues, growth, and development here this morning. Stay tuned. We'll be back to discuss more here on the radio.
Does your child or grandchild snore, have dark circles under their eyes, wet the bed, sleepwalk, have nightmares, or have been diagnosed with ADHD? Did you know these and many other conditions that are present in our children today may be an indication of improper growth and development caused by difficulty with their airway, breathing, and swallowing? These conditions, if left untreated, can lead to health problems in their future. Hi, this is Dr. Mike Rogers of Complete Health Dentistry of Northeast Pennsylvania, and I can help. In my office, we help by guiding growth through a program we call Forwardonics. By realigning chewing pressures, rest posture, airway, and swallowing, we can redirect your child to eliminate these problems and get them back on track to proper growth, development, and breathing. Call me at 570-253-5000 to get your child the air they need.
Complete Health Dentistry. Transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Michael Rogers. I'm Adam Owens, and Dr. Rogers joins me in the studio this morning. Good morning, Dr. Rogers.
Good morning, Adam.
We're talking about airway issues, teeth alignment, and growth and development problems. And before we took our break, I asked, at what age do airway problems begin? And you said...
It can occur right at birth.
Yeah. So my next question is, though, as a child begins to grow, if they're experiencing airway issues, difficulty breathing, wouldn't they complain about it? Wouldn't they make a noise about it?
Well, they some do make noises when they breathe.
Okay.
And that's a warning sign for a parent. If my child breathes loudly or has noises when they breathe, that's an indication there's an airway issue. But no, a child doesn't know normal if they've always been breathing through their mouth or have always postured in that way. And so what happens is their normal is breathing through their mouth, so they don't know any different. And so breathing through the nose is foreign to them,
right,
which is really the way we're supposed to be functioning.
And now, what is actually causing an airway problem? Is it mucus blocking up the sinuses? What's at the root here?
Well, it could be. If you're going back that that far. It
Yeah.
certainly could be. It could be allergies in the household.
Yep.
One of the things people say to me, Adam, is everybody has these teeth in my family. And so it's a family trait that all these people in my family have crooked teeth like this. But what it is it's not so much that it's something in that household or something in growth and development that's predisposing the family in that lineage. Yeah, everybody has a family look maybe.
Sure.
And you've got the genetics for it, but we aren't pre-designed genetically to have crooked teeth.
Yeah, I was going to ask. So, if everything is favorable, if there are no airway issues, does everybody born with perfect teeth, more or less? Or
if you set the stage for growth and development,
Yep.
the way it should be,
Yeah.
then yes, crooked teeth shouldn't even be into the play.
Oh, wow.
It should be a nice, normal, beautiful arch. We've got a beautiful scaffold to create this beautiful arch, and that's our tongue.
Yep.
It's a nice arch form. But what happens is if we don't give it what it needs, if we don't give our bodies what we need, then the tongue gets squeezed in, the arch, the roof of the mouth, which is the floor of the sinus, gets pushed up, everything gets constricted, and it just changes everything. Forward head posture and breathing ability and
it doesn't happen instantaneously. So I'm thinking if you're breathing through your mouth your whole life, your tongue is out of its normal position as your mouth is open. Whereas if your mouth is closed, you breathe through your nose, your tongue supports that arch that's being formed by the teeth. But again, it happens over sort of a longer period of time, right?
Correct.
Okay.
Correct. The other thing that people will say is my child has such beautiful teeth as a toddler. They were perfect.
Yeah.
There was no spaces. Everything was beautiful. I loved looking at my child. And there's a warning sign right there too. Adult teeth are anywhere from 1.5 to 2 times the size of a baby tooth.
Yeah.
And so if your child's teeth at that age are perfectly aligned, there's no space, there's no room, lo and behold, when they start to come in, either they're going to come in crooked or they're going to come in crowded, or there's going to be issues, growth and development, because there isn't spaces. I like seeing in kids when they come into my office, these big wide spaces between their teeth, because then I know, okay, there's room for the adult teeth that are going to be coming in soon.
Okay.
And so we can start to look at that in our office. We do routinely is look, okay, there's crowding here.
Yeah.
Even though they're perfectly aligned, there's going to be crowding. There's going to be crowding in the future.
So if your kid has a picture perfect smile, but their adult teeth have not come in yet, it actually might be worth coming in and having a look, right?
Correct.
Okay.
Correct.
Now, when children are experiencing airway problems, what kind of symptoms are manifesting themselves?
Yeah, it could be difficulty getting up in the morning. It could be restlessness. You go to sleep, if you lay down with your child at night and you go to sleep and it's like a boxing match. They're all over you, pounding all over you. They're not getting their airway the air that they need. Bedwetting. Bedwetting is a big thing with the airway. A lot of studies now are showing that there's a lot of children with ADHD are actually compromised with airway issues. Harvard, Stanford University are all putting out studies lately showing that in 2011, ADHD was diagnosed about 11% or 13% of the children. Now, in some areas, it's 33% of the kids now are diagnosed at ADHD. So, we're supposed to be getting healthier as we move forward in time.
Yeah.
But we're not. So, because if all these kids are having ADHD issues, what's the cause? And what it is it truly ADHD? Which, yeah, there are some kids, quite a few, that may need to be treated that way.
Yeah.
But a lot of it they're finding is an airway issue. They're not getting proper breathing and sleep at night.
So, how do I say this? Is mouth breathing the same? Are all airway problems? Do they exhibit mouth breathing as a symptom?
In one way, shape, or form, yes, they do.
Okay.
If you watch your child and you say, "Well, I watch them like a hawk every day, and I don't see my child with their mouth open, even open just a hair, not even open where their lips are apart, but open where their jaw is dropped down
Yep.
inside, because they're trying to open an airway. So that lowering of the jaw, even though their lips may be postured closed, when they go to sleep at night, they're snoring. They're waking up in the morning with dry mouth. They're waking up with headaches. They're waking up, or they're having nightmares and night terrors.
Kind of sounds like me.
They're nightmares and night terrors and all these other things. You know, people say, oh, he can't stay focused in school, or he's over aggressive, or he's too active. All of these things, some of the studies are showing that the children themselves, even though they don't realize it, they're overstimulating themselves to stay awake because they're not getting the proper air they need at night.
So, I mean, you sort of said parents should look for, even if the lips aren't parted, if the jaw is dropped, that could be a sign of an airway problem. Are there any other things that you can tell parents to look for signs of an airway problem?
Signs of airway problems are these dark shiners underneath their eyes. They got like little black rings under their eyes. You know, that's an indication. They call them allergic shiners of an airway issue. The activity of your child being awake or not being awake can be an indicator of that. Dry mouth. There's a list or a litany of things that thick gum tissue, a gummy smile. If they smile and all you see are a lot of gum, that's on their teeth. Bad breath, dark circles under their eyes. Sleep apnea. I've got one little girl that she actually stops breathing. Her mom watches at night. Yeah. She goes in and watches to see, and she saw her stop breathing. So,
Yikes.
I mean, that's significant as a child if they're stopping breathing. And the thing is we can live for 3-4 weeks without eating. We can live 3 to 7 days without water.
Mm-hmm.
We can only live 6 minutes without air.
Yeah.
So here's the thing: if you take these children that, like I was saying earlier on our CTs, if you take these children that are breathing through these swizzle sticks as airways, they're not getting the oxygen they need.
Right.
So right now they're having developmental issues, not only physically, but emotionally, mentally, all these things, because our body's not getting the oxygen. They're also increasing issues where it's going to predispose them to sleep apnea. Well, sleep apnea is going to increase their weight gain. It's going to increase the way their body regulates with hormones as well, so that our bodies, as we mature, are going to be more predisposed to sleep apnea as an adult, which can lead to heart attack and stroke. It's going to be increase the likelihood of insulin resistance and diabetes, which we talked with Dr. Whitney a couple weeks ago about diabetes being a predisposition for Alzheimer's. So, I mean, airway also has been shown to contribute to Alzheimer's issues. So, I mean, all of these oxygen issues that can start as a child can manifest themselves later on in life.
Yeah.
And so my goal here is to help kids as early as possible. Let's get them breathing well early, and not treat the symptom, which is crooked teeth. Yeah, we treat crooked teeth in our office as well. But let's look back at what caused the crooked teeth. Let's look at the airway. Let's look at the facial features. Let's look at all these other issues and treat that as the symptom of the airway issue and go from there.
We're talking to Dr. Michael Rogers this morning on Complete Health about airway issues, breathing issues, and how they can affect overall health in young children and also later in life. When we come back, we'll talk about more ways to spot airway issues in your kids and some of the treatments available for these issues.
Do you snore? Do you wake up tired? These are signs of sleep apnea. Obstructive sleep apnea afflicts 1 in every 5 Americans. This can lead to stroke, stress on the heart, and even sudden death. Did you know that dentists can treat sleep apnea? Hi, I'm April at Complete Health Dentistry of Northeastern PA. Dr. Rogers uses oral appliance therapy to help patients manage their snoring and sleep apnea. Oral appliances resemble a sports mouth guard, and they are an effective alternative treatment to the CPAP machine and mask that is traditionally prescribed. Our patients prefer oral appliances because they're comfortable, easy to wear, quiet, portable, and easy to care for. If you have been diagnosed with sleep apnea by your physician but are unable to wear a CPAP, give us a call to discuss alternatives for you. 253-5000.
Complete Health Dentistry. Transforming your health for a lifetime.
Welcome back. You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry. Today on Complete Health, we're talking about airway issues, breathing difficulties, and how they contribute to poor overall health later in life and also early in life. Mike, we've been talking a little bit about breathing problems and how mouth breathing can be detrimental to the alignment of teeth and then subsequently to a lot of different things later in life. So mouth breathing isn't necessarily always obvious and easy to detect. If a parent thinks their child is a mouth breather, but they don't see it happening during the daytime, is there another way they can check for this?
What they need to do is go in and observe their child and not just crack the door open and look in and go, yeah, they're sleeping. Is spend some time and look and listen at different times through their sleep cycle. You know, are they snoring? Are they bouncing around the bed? Is there active leg movements? Do they have night terrors or nightmares? You know, do they wet the bed? Wetting the bed is a big thing with airway. A lot of times people will say, oh, they'll just grow out of it. But it's an indicator, an underlying factor of an airway issue. They're improperly breathing. ADHD now, more and more studies are showing, is an airway problem. And what we're trying to do in our office is help parents avoid needing to go on some of these nasty medications if you don't need to. If it is an airway, why go on a medication for it?
Now, what if it's just a minor breathing problem? Is that a big deal?
Well, any minor breathing problem can change habits. You know, and once you get acclimated to this whole new, for example, I had a patient, they got a gerbil as a gift, and in the bedroom came the pet. Yeah. The child was allergic to this pet, started to mouth breathe. Well, and so now that predisposed this child to a whole host of problems. When you mouth breathe, in order to open the airway, you start to posture, your shoulders go forward and your head comes forward. And in that, you've created a whole systemic issue where it's affecting your spine and your neck and your back. So if we got the gerbil out of the room, and the child's airway issues started to clear up, his allergies started to address, and we were just as simple as that. So, I mean, it can happen almost like that quickly, that these chronic airway issues, this chronic obstruction can happen. And now let's try and figure out where. Too much TV right before bed, too much computer time, all these things where we're hunched over and sitting over that kids are doing nowadays, playing with iPads and not being out breathing like they should be, is all once again collapsing the shoulders and the posture. We've got to look back at posture. For example, I can remember as a kid, my mom would always say, chew your food 20 to 30 times before you swallow. Yep. And that's true. It builds the muscles. Chew with your mouth closed. Once again, it's putting your tongue posturally where it's supposed to be when we chew and swallow. Sit up straight. You know,
I just sat up.
Everybody was told that. Stand straight. Yeah. You know, but nowadays, if you start looking at everybody with their computers and their iPads and their all these other things, they're all hunched over. They're all leaning over. And so this is all collapsing our airways, and it's starting earlier and earlier in kids.
So now, what are some of the treatments that you do in your office for people with airway issues?
Our treatments are non-surgical.
Okay, good.
We don't do any surgery for airway issues. But what it is it's retraining. It's retraining the muscles of the head and neck. It's retraining the tongue. It's retraining the child and getting them to breathe back through their nose. We've got techniques in our office. Sometimes it comes down to we use orthodontic expanders. along with it to open and give the tongue some space. But a lot of times we can do this and we want to catch them early. We've got children as young as 3 and 4 that are starting this program because parents have noticed that there are issues with their child in breathing and they don't want it to progress. So we've got young children, and it's easier to correct it the earlier you start, before it becomes set into the whole body skeletal muscle issue and become an issue like that.
Dr. Rogers, if an adult comes to you with an airway issue, is it too late to treat that?
No, it's not. You know, a lot of people will come to me and say, I've been told the only way to fix this is through surgery. Even as a teenager, the only way I can fix this is through surgery. And once again, there's options out there now that we can do. But it's, as an adult, we don't like to go into appliances that can stretch things. But we've got some appliances that even adults can wear just at home and while they sleep to help start to correct all of this and avoid the need for surgery. Will it correct it completely? Well, like I was saying, the earlier we correct it, the better you are. But even as we mature and get further on into it, we can do a lot of correction without surgery.
Now, if someone listening is aware that their child has an airway issue or thinks that they themselves might have one and would like to come in and speak with you and find out what might be possible to solve the problem, what's the best way to get in touch?
The best way to get in touch would be to call the office.
Okay.
The office number is 570-253-5000. Our goal is to help our patients live a longer, healthier life, and without the worry of airway or breathing problems, without the worry of sleep apnea and things like that in their future, without the worry of going on medications for ADHD or having a child with the stigma of bedwetting or not being able to go to a slumber party or over a friend's house because of that. You know, so there's the whole thing. And there, children being able to sleep well at night allows the parents being able to sleep well at night. If you've got a child who has nightmares constantly, or you can't, they're sleepwalking, things like that, we can help address all of these issues.
So once again, if you think your child may be experiencing an airway issue, get in touch with Complete Health Dentistry by calling
570-253-5000. I look forward to hearing from you and helping your child or grandchild.
Thank you for listening today to Complete Health with Dr. Mike Rogers from Complete Health Dentistry. I'm Adam Owens. Dr. Rogers, thanks for spending some time with us.
Thank you, Adam.
Joining me in the studio this morning is Christine Lewis, the winner of the Complete Health Transformation Contest New Year Healthy You. Christine, thank you for joining us in the studio.
Good morning, Adam.
It's great to have you in here. Now, you've been working with a lot of different folks in the area to improve your overall health in sort of all the ways. How are you feeling?
Absolutely amazing.
Yeah?
I feel better now than I have in probably 5 years.
Wow. What do you attribute? Do you attribute this to one single person or a group that you've worked with, or?
It's everyone. It's everyone that's helped me. Complete Health Dentistry, Lynn's Healing Zone, Cole's Gym, Apple Day Spa. Everyone's contributed to my health, which has been fantastic. A big part of it, it started with my teeth, though, getting them healthy, and that affects the rest of your body as well. So you get that healthy, you're good to go.
Has it been hard work?
It really has, and a little bit of pressure, to make sure I really succeed at this.
Yep.
But I'm doing it.
Yeah, the look on your face and the tone in your voice kind of says it all. You really do look great and you feel great. Okay, this may be a little personal, but I'm going to ask anyway. Have you lost some weight here?
20 and a half pounds so far.
Really?
Down from a size 22 to a 16.
A 22 to a 16?
Yeah, so now I'm in normal girl sizes, which is kind of cool.
Oh, Christine, That must feel great.
It does, and it feels good on your joints. It feels just good every day. You wake up, you're not sore, you're not hurting.
That's fantastic. 20 pounds? That's 5-pound bags of sugar that you're not carrying around anymore.
Right, and I don't want to carry them around ever again.
Atta girl. Keep up the good work. Wow. Well, Christine Lewis, congratulations on winning the New Year Healthy You Transformation Contest. And it sounds like you are really all in on this.
I am. I really am, Adam.
Keep up the good work, and thanks so much for checking in with us.
Thanks, Adam.
Complete Health Dentistry, transforming your health.